Welcome everybody here to Western Mass News, your school authority on this Tuesday, where we continue to provide you with the latest info surrounding this horrific pandemic. I'm Taylor Jacobs. We got a lot of questions surrounding schools, so that's really what this whole half hour is focused on, your concerns at home. And joining us this afternoon to answer some of those, we got Dr. John O'Reilly, the Chief of Pediatrics with Baystate Health. Hello, Dr. O'Reilly. Thanks for coming on yet again today. We got some good ones for you, and it'll start like this. A high school in Wilbraham is going remote for 2 days after several students contracted COVID-19. The superintendent of schools says Halloween gatherings are to blame for this, and many students are in quarantine. So the question here is 2 days enough to deep clean the school?
Well, as you can tell by my office, I am not an expert on deep cleaning, but the CDC and the EPA are. And if you go to their website, they have great information about what products work on what surfaces to clean and disinfect against COVID-19. And in fact, that's what we do in our office all the time, and we do in the hospital all the time. We have certain cleaners that we use, and that keeps it safe for patients and visitors. So clearly, with the right crew and the right materials, you could deep clean a high school in 2 days. The issue, though, really is that the closure of the school has nothing really to do with a little bit of COVID that some kid coughed in the cafeteria. It really is about community transmission. It's really about how we are wearing our masks, washing our hands, keeping social distance, and avoiding big groups. And if really this is all driven by some Halloween events where people were getting together, there's no mystery about who's causing the school closed down and who's causing grandma to go to the ICU with COVID-19. It's Colonel Mustard in his living room with a bunch of people without masks who are partying. That's what's spreading the germs within families, within groups. And we need to really shut that down in terms of getting the schools open. And I think that it's great that the schools are clean, but if there's really a big outbreak, we might need to involve the state and get DESE and get DPH in here to do some bigger levels of contact tracing and testing, because that's the public health way to work on these epidemics and outbreaks and get the schools back.
Yeah, good point there as well. And the mystery's over. We know kind of where it was. It's not like it was floating around in school. All right, so how about this? Pfizer says its vaccine is 90% effective, but many people are still hesitant to get this once it becomes available. How long did it take to get a vaccine to this point, and is it safe, do you think?
Yeah, I do think it's safe. And if people are really hesitant, they should look at the CDC and the FDA website to see what a rigorous process it is to get from a potential vaccine to a real vaccine. This particular vaccine really started in January when China let out the genomic sequence of the COVID virus so that we could then model that virus, come up with some potential vaccines. And the BioNTech, which is the German company that started this, really started with 20 potential vaccines, went through rigorous animal testing. And at the end of the animal testing, they wound up with 4 potential human vaccines. And then we go into the 3 phases of human testing. And really, they've settled on this vaccine because it is the safest and has the least side effect. And now we know that, at least in this preliminary data, that it's 90% effective. So I know people are hesitant about getting a new vaccine, but even a new vaccine has been rigorously tested, and the FDA will not allow distribution until it's safe. So if you're choosing between a new vaccine that's been tested and COVID-19 that's killed 238,000 and more Americans, I think the choice here is rather simple. I think everyone should go with a vaccine, keep themselves safe, keep their community safe.
Yeah, and there's safeguards in place, as you said, from animals now to 3 phases. So the final question for you here, if a bus driver tests positive for COVID, what's the likelihood a passenger will contract the virus from them or even the students?
Well, that's always a great question. You like to stump me at the end. And I think there'll be no study of this because it's really a study that we can't with an IRB do. But let's just think about the general facts. We know that outdoors is safer than indoors. And so if you're in a bus and the windows are open and it's bringing in outside air and getting rid of that virus, that's a safer bus. If the bus windows have to be closed, now we're talking about air filtration. We know the planes do a great job with air filtration, but buses not so much. So that adds a little bit to the risk. I think the other thing is how long you're on that bus. If you're on for a couple hours, you're really at risk of getting into contact, where if you're on it for 5 minutes, it might be a little bit less. And then we get to the driver. If he has a small amount of virus that's detected on a PCR test and he wears a mask and does all the appropriate hand washing, well, that lessens the risk. But if he's one of these people that are super spreaders that have tons of virus that they're just spewing out into the air, well, now you're at greater risk because the bus might be saturated with it. So as they say in the bus business, before you get on the bus, Gus, you make a plan to wear your mask, put on your goggles, bring your hand wash, stay 6 feet away from other passengers and from the drivers. And if you touch anything, do the hand sanitizer and keep your hands to yourself, not to your face.
Good stuff.
Have a safe
there.
ride. Get to where you need to be.
Good stuff there. Dr. John O'Reilly, busman as well, but also the chief of pediatrics over at Baystate Health. Thank you very much for coming on today, sir. Be well. We'll have more of your insight in the coming days. And a reminder to everybody at home, Western Mass News, we are your school authority. Call our newsroom at 413-846-0200 or email us at schoolauthority@westernmassnews.com with all those questions and concerns.